to build a more adequate testing capacity. In infection prevention and control, the World Health Organization has provided 1,000 Ebola PPE kits, which are available in the country and being prepositioned to support preparedness activity. Initial preposition is focused on strategic sites, including Kenyatta National Hospital, Kenyatta University Teaching, Referral and Research Hospital, Mombasa, MTRH in Eldoret, Turkana, and other high-risk points of entry. Honorable Speaker, the fourth item was on regional cooperation, coordination with our neighbors, foreign governments, and international health agencies. Honorable Speaker, the House requested a report on that. Kenya is working closely with all the affected and neighboring countries, regional institutions, international partners, because Ebola is not a national problem. It's a regional, it's a global security, it's a global public health security threat. The ministry is engaging in cross-border coordination with our sister country, Uganda, with a particular focus on sharing surveillance information, traveler screening, case notification, contact tracing, laboratory referral, and rapid response readiness. Kenya is coordinating, and we have held meetings at the highest level with the World Health Organization, with the Africa CDC, with the IGAD, with the EACC, with the International Organization for Migration, with the US Center for Disease Control, all these at ministerial level, and with other development partners. This cooperation is focused on surveillance, on laboratory support, on simulation exercise, on technical guidance, training, risk communication, logistics, and partner resource mobilization. And I wish to emphasize, Honorable Speaker, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners provide technical assistance, commodities, financing, training, and logistical support. Regarding the recent media reports alleging that Kenya has entered into an agreement with the United States of Government to establish a quarantine facility for US citizens or foreign nationals, I wish to state it clearly that Kenya and the US government signed an agreement on cooperation in threat reduction, biological and infectious diseases engagement program on the 24th July 2015 during the state visit of our President and President Barack Obama. President Uhuru and President Barack Obama. The agreements were therefore approved by the cabinet then in April of 2016 and subsequently introduced in this House in Parliament, laid on the table of the House on the 19th of July 2016. Upon undergoing parliamentary procedures and public participation and the House process, the House approved the ratification of the agreement on the 9th of February 2017. This agreement subsequently entered into force on 6th of April 2017 and has a validity of 5 years. And Honorable Speaker, the renewing of this cooperation was again signed and came into force on the 5th of April 2022, which the annex I have provided. The extended agreement has a validity period of 7 years and is valid to the 5th of April 2029. Further, on the 4th of December 2025, we again signed a cooperation agreement with the United States of government to strengthen Kenyan healthcare system on our different areas, including digital health, including HIV/AIDS, TB, and malaria. Over the last 23 years, Honorable Speaker, the government and the people of the United States, through the U.S. government health program, has provided close to $8 billion, equivalent to slightly over 1 trillion Kenya shillings, in support of the Kenyan health sector. This investment has significantly strengthened our national response to HIV, TB, malaria, maternal newborn, and global health security. The government of Kenya deeply appreciates this long-standing partnership and remains committed to ensuring that the gains made are sustained through the increased domestic investment, strengthened institutions, and successful implementation of the Kenya-US Health Cooperation Framework, which provides a pathway towards greater country ownership and sustainability of our health program. Honorable Speaker, the proposed Ebola treatment and isolation unit at Laikipia Air Base is part of the 23 similar units to be established in the country as part of our preparedness and response. This facility will jointly be run by the government of Kenya and the US government under the command of the Air Force Commander, the base commander, and the entire medical team of the Kenya Defense Forces, working together with the Ministry of Health. This proposed facility reaffirms Kenya's position as a medical hub in the East Africa region with the capacity to offer specialized care for complex infectious diseases like Ebola. I must also inform the House that aspects of the matter relating to the alleged international health agreements and containment arrangements are now before court. Accordingly, and in keeping with the doctrine of sub judice and standing orders of this House, I will avoid discussing the merits of any active litigation. But I will, however, continue to provide this House with the government's public health position and preparedness status. Honorable Speaker, you also asked about the establishment and accessibility of the Ebola disease control and isolation centers. Honorable Speaker, the House asked whether Ebola disease control and isolation centers have been established in the country. And I want to say this. I hasten to add that there is a significant presence of Kenyans in the affected regions of both DRC and Uganda. Many Kenyans work in Uganda and do business both in Uganda and DRC. And two of our leading banks, KCB and Equity, employ Kenyans who live in that region. In addition, Kenya has approximately 450 specialized KDF officers and servicemen who are in DRC under the MONUSCO peacekeeping mission. Any of these Kenyans could be exposed and could require a quarantine and isolation facility back home in Kenya. The government has established undesignated isolation and treatment capacity as part of our national preparedness. These include, I said, our national referral facilities, our county designated sites, temporary holding areas for points of entry, county isolation facilities. These facilities are being progressively verified for quality, for safety, and for readiness. And I want to reiterate that all such facilities are established for the protection of the people of Kenya and all persons within the Kenyan borders. They are not only foreign facilities, they are not for foreign facilities, they are not exclusive facilities, they are not facilities reserved for any nationality, they are public health assets established and coordinated under the authority of the government of Kenya. In the event of a suspected case The response will be guided by medical triage, exposure risk, clinical need, and public health protocols. A Kenyan citizen, a foreign national, a refugee, a diplomat, an expatriate, or a traveler will be managed according to the same public health principles: safe isolation, testing, clinical care, contact tracing, prevention,